Hi and welcome. I'm Steve Martorano, and this is the Behavioral Corner. You're invited to hang with us as we discuss the ways we live today, the choices we make, the things we do, and how they affect our health and well-being. So you're on the corner, the Behavioral Corner. Please hang around a while. Hello, everybody. Welcome again to the Behavioral Corner. It's me. I'm always hanging. Steve Martorano. What we talk about on the Behavioral Corner, if you're just finding out about us, is, well, everything. Really, we're a podcast about everything because everything affects our behavioral health. It's made possible by our underwriting partners, Retreat Behavioral Health. You'll find out more about them down the road. October the 10th, the day that this episode of the Corner will drop, as we say in podcast lane, the 10th of October, is designated each and every year as National Mental Health Awareness Day. So who do you go to talk to about something like that but the executive director of NAMI? And for those of you who've never heard of NAMI, they are the National Alliance on Mental Illness, and their executive director is our guest, Kyle Carter. Hi, Kyle. Thanks for joining us.
Good afternoon. Pleasure to be here. Thank you.
We have a national day. That's very good. Dedicated to awareness, which is a obvious term. From my perspective, from just a layperson's perspective, and given media coverage and all the talk about mental health crises, spikes in anxiety and depression and drug addiction and on, exacerbated by a pandemic, of course, it seems to me there's an abundance of awareness about mental illness and mental health. So I want to ask you, as someone who's in the field there, as a society, how would you characterize what we're doing well and what more needs to be done?
Again, loaded question. I think, what are we doing well? I think as a society and as a generation, the concept of mental health and wellness is pretty much embedded. I think social media has aided in that process. So I think we're doing that well as far as creating awareness and understanding the feelings when we feel them, so to speak. So when we feel anxiety, when we feel depression, all those things, we're able to at least engage in the conversation. So that's what we're doing well, the awareness part. What we're not doing so well is understanding the value of therapeutic supports. Understanding that therapy is incredibly important and that you can't always manage everything yourself. And also, as a culture, a working culture in this country, we work, but very rarely is rest or self-care or wellness really embedded as a part of our lives. So I think that's the other part. Besides accepting therapy as something that can really be a useful intervention for us, but also embedding wellness and balance, work-life balance into our lives are the other piece that I think we can all do better as a society.
Yeah, it's a great answer because awareness is a kind of catch-all phrase. If I understand what you're saying about here's what we're doing well, we've taken mental illness out of the shadows where we didn't talk about it. We never even spoke about it to a place now where, as you say, we can discuss it openly as a mental health issue.
Absolutely.
Okay. So that leads me directly to, what it took to get it out of the shadows. And that leads to the stigma of mental illness. How would you characterize, I know it's improved somewhat in terms of stigmatizing people, but how much more do we need to go to get people from stop being terrified and stigmatize this disorder?
So I think, to your point, we have come a long way. When you look back in older times, folks that had mental health issues were being treated in closed rooms and you didn't talk about it because the education wasn't there. Well, where we see it sitting now today, the education is somewhat there. We're learning more and more about various mental illness and abnormalities. But where we have to go is the education has to continue in all spaces, all continuums, from 0 on to 100. We have to continue to invest dollars and invest the time, equity, and invest the thought leadership into understanding all the different types of mental illnesses that exist and how it affects everyone, because none of us are monoliths, so it affects each one of us a little bit differently. So just investing the time and thought leadership into understanding all those pieces.
Yeah, we could spend a lot of time, maybe we can at some point, talking about humanity's relationship to mental illness over the years. It was not, relatively speaking, that long ago, hundreds of years, when people were consigned to horrible asylums, thrown away, and referred to as lunatics, and that was the end of it. Out of sight, out of mind. Things have changed dramatically in that period, in this period of time. But we can talk a little bit more about that later. Tell me about NAMI and your role. How long have you been involved in NAMI?
So NAMI Philadelphia, I've been the executive director as of yesterday, 6 months.
Oh, congratulations.
So thank you so much. It was my anniversary. NAMI is a national organization with over 600 affiliates. So I've been in my role. It's been in existence in Philadelphia for about 5 years. I'm the first person of color to lead NAMI Philadelphia, which is, I think, noteworthy for a city of Philadelphia that's very much full of Black and brown people. So again, to have that representation and hopefully that programmatic equity and health equity, I think is incredibly important. As far as some of the things that I bring to the role, I previously served in city leadership for DVHIDS. I've been a professor of psychology myself, a licensed clinician, and I've held other director level positions in the mental health space. So I bring a world of experience and I'm blessed to be able to bring that experience to this role. As far as NAMI and some of the programmatic things that we offer everything from support groups, and that could be grief, nonviolence, gun violence, my apologies, LGBTQI+, youth, and a number of BIPOC supports. There's a number of the support groups that we offer. We offer Ending the Silent Suicide Prevention Program. We offer NAMI on campus, in which we're actually in several universities throughout the city, in which the students are able to mirror NAMI's board and NAMI's composition in order to offer direct service resources to the students right there on campus. We offer crisis intervention training to city police and other law enforcement, along with a plethora of other supports that if I start going all of them, we'll be here for a really long time. But I think when it comes to mental health and mental illness, NAMI is really positioned as kind of the North Star of offering a wide variety and a diverse variety of supports to hopefully affect and cure all.
Oh, so clearly NAMI has a broad series of goals. You outline a couple on your website. NAMI, by the way, it's a terrific resource.
Thank you.
There'll be a link on the podcast so you guys can access it. And you mentioned education. You mentioned your role as advocates for understanding about this. But how about, let's get back to the stigma of it. How problematic is that at this late date? People still have weird ideas about mental illness, don't they?
Absolutely. To your point, you used the verbiage lunatics earlier. The phrasing retardation and things of that nature was used still to this day, but very recently. And what those things essentially do is it casts a really negative dispersion around those that are affected by mental illness, caregivers and those directly affected. So what it more often than not does is stop people from actually looking into meaningful care. When we talked about earlier about equity and those that are deciding, I don't want to get a therapist because it's that dark stigma, that dark cloud that sits over it. So I think it deters people from really looking into meaningful care to hopefully support their mental illness and the various challenges.
Yeah, I want to take a look at 3 areas of society and how they manage these things. Well, 3 or 4, but first there's people of color. Does that constituency still have the sort of attitude that mental health treatment and care is for people of means, and somehow they may shy away from it, either lack of resources or a sense of, come on, man, just man up. You're depressed. Of course you're depressed. Things are bad here, right? Is that still prevalent in that community?
Absolutely. So what I have to preface it by saying, obviously, as a man of color, we are not a monolith, so I don't speak for everyone, but I can speak from myself and my professional experience. That I don't necessarily know if the therapeutic supports are for people of means. I think that the more pervasive issue of why people of color do not seek it is the weakness piece. You're perceived as being weak if you go with a therapist. Man up, the man up thing, and that's for all genders. It doesn't necessarily have to be for Black men per se, but I think it uniquely affects Black men.
Yeah, it's also characteristic of other ethnic groups,
Absolutely.
American. I mean, an Italian American family. When I was growing up, I mean, the idea that someone would be seeing a therapist was not. It wasn't so much stigmatized as it was never thought of. Nobody
Mm-hmm.
was in therapy. So I just mentioned people of color because across the board, as you know, in healthcare delivery and treatment, they lag behind for a multitude of reasons. Let's talk about the police. I mean, I think most people understand now that mental illness can be treated, and that you can get help. But there's a point at which mental illness intersects with society that precedes all of that, and it is very often at the point of a police presence.
Mm-hmm.
I mean, police see more mental health issues than psychiatrists.
Mm-hmm.
I would say, or they're a close second anyway. How well do you think, in general, I know it's in a general statement, police are being trained to understand what's going on in a situation like that where a mental issue may be at play?
Well, I'm going to start by, unabashedly giving NAMI a pat on the back, along with Philadelphia police and fire departments and things of that nature, for instituting things like something that we do, which is crisis intervention training. And that is a proactive approach to work with law enforcers that are going to intersect with those that have mental health and behavioral health challenges. And we offer different training and scenarios and things like that to arm them with some strategies so that when they intersect, they're able to handle it appropriately and preferably without violence or incident. So I think based on integrating tactics and interventions like that, we're doing better than we used to. And I think, go ahead.
No. Go ahead. I'm sorry.
No.
I was just thinking. So let's talk about Philadelphia, which is what your chapter is, where your chapter is located. With regard to cooperation with the authorities, it sounds like the police are on board in a training sense. Do mental health crisis counselors roll with any police that you know on a regular basis in Philadelphia?
Yes, so there are, as part of CIT and associated programming, there are CIT officers that support the different districts all throughout the city. We're offering different trainings and supporting the cops as they interface. So there's ongoing trainings, ongoing strategies, ongoing interventions that are being poured into these different districts. That way law enforcement actually have some degree of something to pull from when they're thrown into some of these very unique and sometimes very dangerous situations.
Yeah. And for those people who think that this is solely a benefit for the disturbed person or the mentally ill person, it also helps policing. Because I mean, anything that will lower the threshold of violence and death maybe is a good thing. I think more police departments should be actively involved. That's sort of a mission across the board nationally with NAMI,
Absolutely.
right?
Absolutely.
To get police to work. And then I guess the final, there are so many other aspects of society, but the family becomes a major component in this. Mental illness is a family disease in a sense, and there can be tremendous collateral damage from someone who has mental health issues among their family and loved ones. What kind of support is out there for families with people suffering from mental illness?
Absolutely. And you raised a very important point that mental illness and behavioral health challenges, that affects the whole person. And part of the whole person is the family, it's the community. So I think as far as NAMI in particular, we offer a number of different programs. So I will mention the support groups that we offer for families. We offer some of our signature programming, family to family, peer-to-peer.
Yeah, go
ahead. Sorry about that.
That's all right. I got you.
So we offer family to family, peer to peer, and those are NAMI signature programs specifically embedded to work with families that have caregivers or family members affected by mental illness. And we offer trainings, ongoing trainings, as well as a support group format to help support families in the ongoing battle. Because again, nobody's a monolith. it affects families differently. So what we try to do is just arm families with strategies, interventions, scenarios, and everything we can add to their tool belt to deal with all the very difficult dynamic challenges that come with working with someone and living someone with mental health challenges.
So someone listening to this who might be confronting a loved one with a mental illness problem, they call someone like NAMI and say, I need to talk to some people. Is that how it would work?
Yes. So what you could do, the best way to do it is to go to our website, NAMI Philly. So that's NAMIPHILLY.org, NAMIPhilly.org. You can go in and you go to the content. So first you can go to the different tabs about us, and then you can also learn about our particular program and get a bit more broader understanding. Once you feel like you're interested in, you would just simply go to the contact us page and we would reach out to you and talk to you about our different support groups and hopefully you being able to join.
These support groups are led by mental health professionals, or are they just peer? Are they all peer to peer?
They are led by professionals as well as those with lived experience.
Okay.
And I just want to mention, most importantly, they are all free.
Yeah, they're free. I was going to get to that. Let's talk a bit about the effect of the pandemic has been negative across the board, touching every aspect of our lives. But it has had a devastating effect on our mental well-being. Are you seeing more young people or parents of young people talking about mental illness among younger people?
Yes, because unfortunately, the pandemic created just such a dark cyclical effect when it comes to isolation by both the adults and the youth. So then the youth turn to social media, but you still don't have that person-to-person, in-person interaction. So that leads to sometimes some mental illness and mental health challenges. And just that lack of in-person social communicative experience also adds additional challenge. More often than not, the additions of stress for parents that more often than not had to essentially become teacher assistants because of the transition to home-based learning as opposed to being in brick and mortar. So all those things, the isolation, the different stressors on parents, and the lack of social communicative situations for youth by being confined at home, all kind of brought together a really difficult challenge for 2 to 3 years, and we're still trying to get out of it, unfortunately.
Our guest is Kyle Carter. He is the executive director of NAMI, the National Alliance on Mental Illness, on this Mental Health Awareness Day, October the 10th. Kyle, do you agree with other people who've looked at the situation of social media and said that while there's much that we can benefit from social media, it also has a downside, and it can ironically isolate people rather than bring them together? Are you seeing that among people who come for help at NAMI, a kind of sense of isolation?
Absolutely. I think there's a lot of isolation. So then people are very much stricken with the desire to kind of follow others with different ideals and things of that nature. And that just unfortunately leads to a lot of challenges, a lot of anxiety, a lot of stressors, a lot of depression, because again, there's that lack of social communicative experience, being in person, talking to people. They're just simply on a computer, more often than not directly communicating with anyone. So because of that lack, you're kind of just led by just words as opposed to any kind of substantive action.
In the treatment of substance abuse, the clinicians and the treatment providers often use the term co-occurring disorders, and they are almost always of a mental health variety. They seem to go hand in hand. Two things. One, with regard to substance abuse sufferers, NAMI can direct them for help, but you don't directly provide substance abuse counseling, right?
So excellent question. So yes, NAMI, one of the key resources that we offer is our warm line. Our warm line is not a crisis line, but what it is essentially a resource hotline in which we will connect folks with various resources around the city. So whether it's other providers, whether it's the Philadelphia Crisis Line if needed, 988 if needed, any type of substance abuse centers if needed, all those different resources we have at our disposal that we have available that we can connect you to. So while we're not a direct provider, we are someone that can direct you to resources as needed.
And the other area where there's a pronounced intersection between mental illness and society is homelessness. What I know there's no number you can put on this, but how large a problem is mental illness among the homeless population in your guesstimate?
I'll just, rather than utilizing a nominal figure, I'll just say it's a huge problem. I'll just say it's a huge problem. We know that homelessness throughout the city, and there's areas like Kensington in which it is incredibly pronounced. And again, when we speak about co-occurring, we see the addiction and the substance abuse crisis that really exists in a pronounced nature in the Kensington area, but all across the city, that when you have homelessness, you see depression, you see substance abuse, see all these things kind of compile and bring themselves together to just create a really dangerous situation. So there is a huge intersection between mental illness and homelessness and substance abuse, and it's a huge problem specifically in the city.
Yeah, Kyle, you have, as you mentioned earlier, a very extensive and deep background in this field. But you didn't always have your attention focused on this. I wonder if you have the same experience I have had the more I learn about mental illness. And that is that I find myself now being far less quick to judge a behavior I see as the work of a bad person, or, well, that guy's drunk. We all see the videos that are posted of people behaving badly or are inebriated to the point where they're fighting. I tend to find myself now going, that person has a problem. They're not just jerks. They may be, but they're jerks with problems.
That could be a separate issue.
I know you have grown to understand that. That's really the core issue here, is to get people to look at these behaviors and say they need help.
Yes, to have people view people that have mental illnesses and challenges as humans, flawed humans. And I'll tell you, one of the reasons why I pursue this work is because I come from lived experience. My mother was stricken with clinical depression. So around 11 or 12, that's something that we had to deal with. I was raised in a single parent household. So that's something at the age of 11 and 12, I got to see my superhero become a very flawed person. And we had to work through that. And I had to become very mature very quickly to help support her through that and the different addictions that came with that. So yes, my own experience is, it does humanize you. But again, it's removing the stigma as a society and saying people as humans and not simply identifying them by their challenge.
Yeah, it's easy to say that this is a character flaw and dismiss it as such. And it is not. It's a disease. It is a brain chemistry disease, a group of them. Finally, a couple of things. Finally, in the workforce, one of the reasons people would be reluctant to mention that they're having mental health issues is the fear of losing their job. Can NAMI advise people on what their rights are, employment and work rights, or direct them in places where they can find out?
So we would more likely do the latter, which is directing them, say, if we're looking at the area of rights and legal supports, community legal service or something of that nature. So we would be the director, kind of a navigator in that sense, to ensure people have the right resource to learn all the information that they possibly need in their situation.
And there are far more protections than they probably are aware of, right?
Oh, yes, absolutely. Absolutely. And again, education is the central point of all of the mental illness, mental health, and behavioral health challenges. So it's important to be fully educated on your rights and everything associated with that.
Yeah. Kyle Carter, thanks. This last thing, on your website, you have a mission statement, and yours is very, very clear and very to the point. You talk about the goal being in regard to mental illness, mental health, prevention and cure. Now, I know you think these are doable, but really, prevention and cure of mental illness, pretty lofty.
Very lofty goals indeed. And I think when we have to be reasonable when we think about the phrase cure. The cure for mental health challenges and mental illness is education. So all of our advocacy, all of our programs have one central focus, and that's educating the public. So I think if we're properly educated, for our rights, for the different interventionists and strategies to help us push through some of these mental illness challenges, that's when we can progress as a society. So when we think of cure, we think of education.
Yeah, we all get better. It's absolutely doable. Kyle Carter from NAMI, thanks so much. People want more information. They should refer to the website. We'll have a link for that. How are you guys funded, incidentally? Donations or what?
Yeah, normally sponsorships and some small fundraising. But again, we have our big walk this weekend on October 7th.
Yes.
And then we have some ongoing things as well. Feel free to go to the website to, take a look at what we're doing, and feel free to donate as well. But yeah, just the generosity of sponsors as well as the community.
Thanks so much. I hope you can come back and see us from time to time here on the corner. You're a great resource.
Thank you so much. Thank you so much for your time.
And thank you guys for yours as well. It's the Behavioral Corner. You'll find us wherever finer podcasts are being dispersed. When you do, check us out. We got all the shows up like a library. You can go back and look at some of the old ones. If you like it, subscribe, follow us, like us. We're on all those platforms. See you next time on the Behavioral Corner. Take care.
Retreat Behavioral Health has proudly been serving the community for over 10 years. Here at Retreat, we believe in the power of connection and quality care. We offer comprehensive, holistic, and compassionate treatment from industry-leading experts. Call 855-802-6600 or visit us at www.retreatbehavioralhealth.com to begin your journey today.
That's it for now. And make us a habit, hanging out at the Behavioral Corner. And when we're not hanging, follow us on Facebook, Instagram, and Twitter on the Behavioral Corner.